When it comes to choosing therapy, Dr. Pemmaraju, it's important to work with your healthcare team to identify what is going to work best for you. So, as a clinician, how do you define shared decision making?
Very important. So shared decision making to me means a partnership. It means a journey that the patient and the providing team are about to embark on. It's a very different approach than a one way, I tell you, you do this. Instead, I see it as a bi-directional exchange of ideas. Each visit, each Epic in-basket or EMR communication, each touch with the healthcare system, the pharmacist, the PA, nurse, whoever is dealing with the patient. I think that's the key. So a bi-directional exchange of ideas. What's important to you as the patient? What's important to the caregiver? What's the worries? What's the barriers? Designing a treatment system around that, a treatment paradigm and approach, discussing risk benefits, side effects, toxicities, alternatives, and then a constant dynamic reevaluation throughout. That's what I picture it. It has to be a journey and a partnership.
Well, part of making care decisions is setting goals, and I think you've just alluded to that. What are treatment goals for myelofibrosis, and how are they determined?
A great question. Myelofibrosis treatment goals are changing in real time. I would say, as of this recording, 2024, the main three things that I want patients to think about and the caregivers. Number one is stem cell transplant eligible or not. It's used to be based on age and comorbidities, but there's other factors. So are we going to stem cell transplant or not? That determines a lot of the journey. Two is clinical trial or not. So are we doing the standard of care therapy, often one pill at a time, or a clinical trial, either an IV drug, a pill, or combinations? And then three is that dynamic assessment that we talked about, which is what are the goals of care? Often our patients with myelofibrosis have decreased quality of life, enlarged organs, fatigue, cachexia, malnutrition. These are the central components. A lot of times they're due to the myelofibrosis itself, so the treatments may improve that. A lot of times it's the other comorbidities, other health issues. So working with the PCP, the primary care provider, the local team, in my case, many of my patients are referrals, as you know, the local MD team. I think these are the three components: transplant eligibility or not, clinical trial versus standard of care, and then once we've made a treatment decision, minding toxicities and quality of life.